Thank you for being part of this important final session, local to global, aspirational, realistic. Let me just say a few words before I introduce our thought leaders for this important panel discussion. Last week, the world crossed a painful new threshold, 5 million lives lost to COVID-19. Nearly 3/4 of these deaths are among older people. This devastating milestone reminds us of the enormous toll on the lives of older persons and the importance of reinforcing our efforts to uphold their rights. With ever-aging populations, a global phenomenon, new opportunities are constantly opening up for businesses. Against this backdrop, though, today our panel of thought leaders contemplates how can we disrupt the healthy aging market to enable innovators to develop more effective services and products for people as they age through the collective sharing of best international practices, thinking and ideas. The question that we need to ask our thought leaders today is local to global an aspiration or actually realistic? So I'm going to introduce each of our panelists today, and then I'm going to ask them to give us all their 3-minute elevator pitch to the question, is it aspiration or is it realistic? And then we're going to go into a robust discussion and finish off with key messages from each of the panelists. So join with me in welcoming each of the panelists, speaking in order. Jean Axius, Senior Vice President of Global Thought Leadership at AARP. The second speaker will be Klaus Niederlander, Director, Ambient Assisted Living Association. Our third thought leader is Grace Chan, Business Director at the Hong Kong Council of Social Service. And our final speaker, Mike Short, CBE, Chief Scientific Advisor of the Department for International Trade. And just to make sure that all of our thought leaders understand the instructions, you have each 3 minutes to respond to that question. So Jean, welcome to this important session and the floor is yours.
Well, good morning, Jane and my fellow panelists. Good afternoon, good evening to our audience. I am extremely honored to be part of this conversation. And what I will start off by saying is the fact that Brian Stevenson once said that effective problem solvers, to be really effective, one has to get close to the problems. Otherwise, you miss key details and nuances. So you can't be an effective problem solver from a distance. You have to actually get close. And Jane, as you opened up the conversation with regards to the COVID-19 pandemic and the deaths, we know that nearly 95% of all COVID-related deaths, particularly in Europe, were for people over the age of 60. In China, it was 8 out of 10 COVID-related deaths were of people over the age of 60. And in the United States, COVID-19 patients ages 65 years and older were 35 times more likely than those ages 5 to 19 to be hospitalized. I share this because of the fact that in order for us to be effective problem solvers, we really have to take this opportunity through this significant crisis to think about how do we start to reimagine, rebuild, and strengthen our societies in a way that actually meets the needs of an aging population that's not just aging, but in many cases living much longer. And what are the opportunities to actually do that? So we know, particularly in the US context, through the work that we've been doing with age-friendly communities and states, the opportunity to work across multi-sectorial organizations and sectors to really start to address how do we create livable communities. We know that there's a connection between where people live and how long they live. And we also know, as we've actually seen, particularly from that wonderful video, that the important aspect of all of this is that regardless of where you live, there's a strong desire to live a healthier, longer, more productive life, to be able to contribute, to be able to give back, to be able to connect. Those are critical themes that actually are transferable across the world. And the World Health Organization indicated, as this video so well presented, that there's over 140 million people over the age of 60 who don't have access to basic needs. So I am excited to share with all of you that we just released a major report called our Age Readiness and Competitive Report that identifies innovations, particularly in the health space, to really close these gaps between how long people are living and the quality of their life in terms of their health. And what are the opportunities to work across sectors to do that? Whether it's in Singapore, where the Singapore government has actually focused more on local strategies and moved away from the strategy of disease to a focus on health promotion at the local level. Or in the case of Taiwan, with their age-friendly hospital system, which aligns very well with the US age-friendly health system aspects, accrediting hospitals to incentivize them to better serve the needs of the older population. Or one of my favorite innovations is what we're actually seeing in other countries like Uganda, where they have something called the Clinic in a Box system, which are solar powered clinics that actually go into rural communities to provide telehealth, medication, and training for health services. These are local innovations in some cases that are actually going global. These are opportunities for us to really kind of look at, what can we do to become effective problem solvers by getting close to some of the challenges that COVID has demonstrated to us in a way that rebuilds our systems so we're much more resilient. The other aspect I would quickly say is the fact that, as we know, with the fact that the population is aging and the fact that in many cases they are living longer, they're also significant consumers. So for the business community, for the innovators that are part of this conference today, the question that I have for you is, how are you, what is your aging longevity strategy for this growing aging market? So with that, I think my time's up.
Thank you very much, Jean. What struck me is that you started off by saying we need to get close to the problem. And our next speaker, Klaus Niederlander, is certainly close to the problem. But I just want to pull out also, the way that you actually pulled in age-friendly, that being one of the action areas of the decade of healthy aging. And also you intimated, the social determinants of health impact not only life expectancy, but quality of life. So, Klaus Niederlander, the floor is yours.
Thank you very much, Jane, and thanks for the invitation. Well, let me use my 3 minutes accordingly. In the Active Assisted Living program, we've actually brought together and connected people, organizations, as well as those emerging regional health and care ecosystems, but basically those who are already concerned, confronted, affected, or simply engaged in the challenges and opportunities of an aging population. The focus was on developing digital-based solutions for aging well. So meaning develop tools to be able to stay longer at home and in your community. And in particular, as you mentioned, COVID, to stay connected and active, which was a huge challenge for many of our older population, but not only. And this program is supported with financial and operationally by 23 national and regional public funding agencies from 18 countries around Europe, but also in Canada and Taiwan. So local to global, a reality for us over the last 10 years in terms of collaboration, joint projects, networking, and building the strategic capacity for dealing with the global phenomenon of an aging population. Yet, I'm afraid we are only at the beginning and are still exploring, far from exploiting the gift of longevity and to adapt our societies. It takes time for people and organizations to feel concerned, especially when it's about a slow, long-term change. You tend to feel only, when it's already high noon. So when the exponential growth of the societal or natural phenomenon is already well underway, as we're experiencing right now in this decade, not only with global warming, but also with an aging population. So our initial projects serve to create that awareness, consciousness about an aging population, making use of the emergence of digital technology, a technology which facilitates connecting people, but also treating masses of data and ideally providing better services. Because most of us were simply, I would say, unconsciously incompetent about this aging phenomenon and what it means to our lives, all our lives, from young to old. And it's not just about the current health and care debate, which in reality is much more about disease and dependency. It's more about positive health and prevention, about taking care of ourselves and the others. It's about living in our homes and communities, as already John has mentioned, and it's above all about leading a meaningful life by being part of a society, being needed, and being able to share one's experiences. So an important focus of our work was actually about a new narrative on aging with a strong impetus from the new old, of these baby boomers. It's about activating the potential of a growing part of our population, which was put aside because of age. It's about opportunities for better health and care, redefinition of work, about living together between generations in the 21st century. It's about a revised social contract. So projects can help activate this potential, yet change happens in systems. And what better tool than learning from the emergence of health and care ecosystems, that web of people and organizations who are engaged together in creating impact. So this is not just about knowledge of different health and care systems and cultures or sharing of best practices. Those are awareness tools. While ecosystems provide learning and action tools. So it's about collaborating on joint challenges and opportunities, such as ensuring quality of care, not just in the hospital, but also in the community when the person leaves the hospital, as we have witnessed in examples in the north of Stockholm. It's about developing a collaborative governance system in designing care policies with the inclusion of a chief experience officer and an informal representative governance board in the Netherlands, for example. Or it's about new organizational forms, such as social enterprise and corporate in Italy. Now we'll be almost done. So in the UK, deliver more person-centered services. Aging concerns us all, and it requires a culture of collaboration rather than of competition, a person-centered mindset rather than a standardized product, and the freedom to test and experiment, to self-organize rather than receive commands and control. Thank you.
Look, and thank you, Klaus. And I would ask all of our speakers to see if we can make your elevator pitch available, because I think that, there is such substance. But, Klaus, two phrases that you use, which were, for me, light bulbs. We're just at the beginning. We're far from exploiting the gift of longevity. And I haven't heard it framed in that way. But the other one, not so favourable to us, is, we're unconsciously incompetent. And I think, yes, that's correct. But through your long elevator pitch, it was the thread of digitalisation and technology. And that leads us beautifully on to our next panellist, Grace Chan. The floor is yours, Grace.
Thank you. Today, I will try to look into the word innovation. Innovations has long driven advance in productivities and also the economic growth. But while it is true that the contributions of innovations have not only been economics, it must go hand in hand with the social, progress, how we try to use innovation to meet the social challenge. When we talk about it, have we think about demand driven, this kind of words? Nowadays, we all know that the social challenge are very numerous, very complex, and some of us will say it is very urgent. However, when we talk about if we use innovation as the main engines of growth, have we see the two overarching trend, for example, the innovation and also the social challenge, can go well together rather than they are not going well together. So this is very important. A few things that I would like to highlight is the awareness of the scope of the social challenge have to be heard by the people, what they call the innovator, and also we have to involve a lot of stakeholders. We need to cultivate a very good future dialogue to hold all these stakeholders together to interact and also to liaise. And I am a big fan of age-friendly city. Everyone knows about that. I would say citizens' involvement, or maybe I would say their buy-in, is very important. We have to extract good practice from local and overseas. We have to maintain research support or impact evaluations, or maybe we can address some kind of success. We pay for the success. We try to look into different model to build the network to address what we have done. And two more things that I would like to mention is, if we try to integrate innovations to both social challenge and also the supply side, the competence is very important. Do we try to, or have we put effort on the competence to build the what we call the social influence, and also the progress of we try to call for greater involvement of the stakeholders, and also we try to introduce the necessary capability on also the interest to address the issue together. This is very important. And also another backdrop I need to paint is, when we talk about the international plan of action plan on aging, we always talk about older person and development, talk about health and well-being, talk about we have to ensure the enabling supportive environment. These are not new term to us, but we have a lot of new framework. We have to bring in all these new framework into our competence, and also use of innovation to build the good practice. So this is something that I would like to share.
And thank you very much, Grace. What you've added to the conversation is this dimension of innovation, the scope of social challenge, but also the supply side. You mentioned that these terms are really bread and butter to many of us. Age-friendly, environment, enabling, capability, capacity. But it's about trying to operationalize those across a multi-sectoral approach, which includes disciplines that are not so familiar with this population, keeping in mind that older people are not a homogeneous group. And then we actually have, the social determinants that create opportunities, but create challenges as well. I think also the last point is critically important as we go into our final speaker, Mike Short, CBE, and that is really the new frameworks and the social influence. We can have frameworks, we can operationalize. Now I need to stop. But it's about how do we actually use these new frameworks, to create social influence, and the legitimacy of older people intrinsic to this process rather than just sitting at the table. So, Mike Short, the floor is yours.
Thank you very much. It's great to be part of this panel. I also am speaking, having launched Healthy Aging Solutions to a Global Challenge earlier on today, and hopefully that's available to everybody on this call. But thank you for some of the contributions and support from my DIT colleagues, and indeed AARP, AAL, and other Hong Kong representatives as well. These frameworks are very important. So when splitting aspiration from realism, I think it's very important not to start with technology. It seems absolutely key that whatever solutions we're offering have to be trusted, available, and cost effective. And for many of the videos that were early on, they didn't show much in the way of technology. So there are some gaps to be filled before some of these solutions can be realistic. So thinking about trust, it cannot be technology push, it needs behavioral adoption. It needs acceptance in communities. It needs education. It's not purely a matter of technology. In terms of availability, I often draw from the mobile industry that I've grown up with, which today supports close to 9 billion subscriptions. That's not just people, it's also connected machines. But it's the most connected solution on this planet today. But even today, there are many people who do not have a mobile or have access through mobile to the internet. If we take the numbers in July this year, 50% still are waiting to access the internet, whether through mobile or broadband. So clearly the choice of access to the internet and access through technology to services needs to be addressed. We also need to think about how some of these technologies can serve different communities and different languages and different cultures. And if we look at much of the content on the World Wide Web, it's still not really age friendly or language friendly, or dare I say it, culture friendly. So we need a much bigger push from the internet and content community to actually deliver more services and richer content to everybody. The availability also could be extended when other sectors become involved. And Jane's point about it being multi-sectoral, I couldn't agree with her more. But things like access to energy will play a part in healthy lifestyle, access to financial services. It's quite remarkable that the world of mobile has delivered close to 1.3 billion mobile money accounts in order to transfer money from A to B through a mobile mechanism. Money helps to make the world go round, and money provides more availability of choice, buying power, and indeed access to solutions. We also need to think about how innovation will continue, and I'm a strong believer that innovation will be part of the solution going forward. When we look at perhaps new financial services or new online shopping, it's quite clear that with COVID, more and more of the activities we've known, whether it's work or education or even online shopping, has gone online. So we need to think about making sure that that's available to all and understood by all. And actually, therefore, I would suggest that the technology we're offering needs to be looked at through the lens of not just aging, but diversity and broader inclusion. Diversity inclusion needs to be at the heart of all this innovation. And just to finish, I think really what we're at today is a position where aspiration can be beaten by realism if we adopt the technology in the right way with a people-centered approach.
And thank you very much, Mike. I think that really sort of pulled many of the aspects together. I think, one of the key facts that you stated, and I'm sure it's stated in the report that was launched today, and yes, it will be made available. I see that we have it in the chat box, and I'm sure that each of us on this panel, can also disseminate it. It's the fact that less than 50% or around 50% of people in the world are not connected. And I think that's a very real issue that we need to take on board when we're thinking of any populations, current and future older people, but across the board. I want to come back to the panel now, and these questions are not ones that you know. So put on your thinking cap. And it's really about scalability. I think much of what we've been talking about, fits very neatly into a high and middle income country. But let's actually shift our focus just for a minute, into lower and middle income countries. So how do we scale up, innovations, Grace? I'm thinking of you. How do we scale up innovations, to meet the demand, of older people in lower and middle income countries when, quite frankly, we can't even get vaccines to them at the moment? So I know it's a curly question, but give it a go. And then I'll go to Mike for a comment.
Okay. I would say that not just only in Hong Kong, but I think all over the world, we have different opportunity or maybe different challenge to what we call the adoptions of technology, adoptions of the new things. This is something that we have to think about, our financial situations or maybe what we call the social service financing model. For example, in Hong Kong, when we talk about technology for population aging, lots of people think that maybe we can ask the government try to give the money to give the NGOs, or maybe we have the voucher to let people buy the products. But however, when we think about it, do we really need all these, or whether we supposed to have a thinking of whether we can access to the product or access to some kind of technology, for example stair climbers, so that in Hong Kong maybe we are not just asking people to provide us money to buy the stair climber, but we can produce or maybe co-create a stair climbing service. You know, we try to ask people to do something or with the products, and then we can have and enjoy the service. So eventually, we have more than 1,000 people pilot, you know, a stair climbing service. We have a central hotline, you know, people call in, and then we can disseminate a team of people, send them to support the older persons to get down to the old building, because they have stair, they have difficulty to go down and enjoy the mobilities. So this is something that we have to think about, whether we should, you know, talk about not just only adoptions of technologies, but affordability by, you know, for example, renting or even like a library, you know, borrow something like this. I think this is something happened in COVID as well.
Okay, so really you're actually co-create, you know, based on, you know, particular issues, but then you're really looking at different service models. And I think at the heart of this is about function. Let's not forget function. It's the person and the interrelationship with their environment. And it goes back to this whole decade of healthy aging. Mike, comment, and I can see Klaus just itching to say something. So, Mike, your comment?
I would offer a 3-point plan. Firstly, sharing. I think the problem is so big it cannot be dealt with by one government or one country alone. So sharing best ideas is a good start. Secondly, partnerships. I don't think government can fix this on its own, whichever country you're in. So some of the partnerships they have with the energy companies, with the finance companies, with the telecoms companies should really bring about change. In finance, clearly having age-friendly policies that help saving, that help pensions, that help solutions that make it easier to spend or borrow. With regard to energy, clearly making sure that the energy is where it's needed. And that perhaps is a follow-on to some of the COP26 and evening up the carbon footprint to something better than where it is today, but also makes sure that there are energy-friendly policies as well as age-friendly policies. And thirdly, I think the telecoms community that will continue to innovate, whether it's through new internet-based access services, apps or wearables. I think these could be encouraged through regulation, through partnerships, if you like. And the last point I'd make is I think from the health and care point of view, I think there should be regulatory support. A lot of the regulation is often orientated towards safety from a health point of view, but why is it not regulated towards inclusion? And to me, this has to be about inclusion, diversity and inclusion that serves the needs of everybody in the elderly or healthy aging community.
Yeah, I like this regulation by inclusion, Mike. I'll sign on to that one. So I'm going to go to Klaus, but then Jean, I'm going to ask you a different question about what's going on in the United States. Klaus, scalability. How do we manage this?
Indeed, I think, you know, when you mention scalability, a lot of think about big and bigger, but I think actually that's an analogy from the industrial age. But in the digital age, it's different. You know, industrialization was about standardization of machines. Digitalization is about personalization and people. So it's actually not about bigger and bigger. It's about the right size, the human size. You know, if you provide services, it might not be good to provide service by one organization to more than 100 families. Maybe that's the right size, you know, and then you have to look at a support level, you know, and then you reproduce it. So, and technology can help, but I just want to make a sense, technology and money most of the times are totally overvalued. And actually the people, the humans are undervalued, but that's where the real value lies. If we talk about healthy aging, this is not about money and machines or technology. This is about people. And I think that's where the biggest gap is. That's where we need to talk much more about, you know, a new culture of collaboration, about person-centered mindsets, self-organization. Then we talk about, you know, business models, yes, service models, yes, but we talk about governance models and organizational models. That is and what shape it needs in our century, you know, to deal with those global problems.
Yeah, I just love listening to you, because there's always this sort of, you know, clip, you know, technology and money are overvalued. So I'm going to post that afterwards. So Jean, I want to come back to you and talk with you about marginalised communities. So I'm thinking about older men, older women, older prisoners, older migrants, older LGBT. So, in the United States, how do you reach, those marginalised communities which are actually rapidly expanding around the world? Could you make a comment on that? And then we're going to go to a question from Anna Dixon. You're mute, Jean.
I'm muted. I said thank you so much for that question. I want to build off of the points that Mike and Klaus also made, because I think that's critically important, particularly as we think about where we are today and many of the inequities that we've seen as a result of that's been amplified, frankly, by this pandemic. I think it's absolutely fair to say that for so long we have designed systems around, particularly excluded those who have been in the margins of life. And the question becomes exactly how do we start to actually ensure that we're actually building systems with those who have historically been in the margins at the center. And part of how we actually have to do that is a couple of things. One is to actually recognize that there is a cost to inaction. So I absolutely love what Klaus actually said in terms of money and technology are sometimes overvalued and people are not. And what I mean by that is the fact that particularly in the United States, the Ford Foundation found that inequities actually cost the United States $8 trillion worth of economic value by 2050 if we do absolutely nothing. A similar type of study that we did at AARP found that the cost of age discrimination actually cost the United States $850 billion worth of lost productivity in 2018. We're going to be releasing a report in the next couple of weeks that finds that the cost of unequal life expectancy, particularly in the US, cost us $1.6 trillion by 2030 if we do absolutely nothing. And that if we actually were to try our best to ensure that people had equal opportunity to live a longer, healthier, and more productive life, we would see an additional 5.9 million people alive by 2030. 95% of those would be people over the age of 50. So in other words, these inequities that we actually see actually hampers in all of us, not just those communities. We're all interrelated and all interdependent. So as we think about scalability, as we think about the path forward, we have to really think about exactly how do we ensure that equity is at the center and how do we ensure that we're co-creating solutions, particularly with those communities? And how do we approach those communities from an asset mindset rather than a deficit mindset? Focus on exactly what do they actually have and leveraging that rather than what they actually lack. And some of the ways we can actually do that is through subsidizing their participation as part of the co-creation process in some meaningful way. I used to work for a program called Money Follows the Person, which is a major demonstration program at the federal level. And we wanted to ensure that people who were on Medicaid, who are low income, people with disabilities actually were part of the governance process and helping to create these programs and also advising policymakers moving forward. Because we knew that these beneficiaries had limited income, that we actually provided them with some subsidies so they could actually participate in these meetings. So they didn't actually see a loss in their financial security. So really thinking about what are the barriers and how do we start to address those, I think are critically important.
Okay, look, thank you very much. And as we wrap up this session, there are two questions that I'm going to ask each of the panelists. The first is really from Anna Dixon, and I think it's a relevant question as we are in the first year of the decade of healthy ageing, keeping in mind the 4 action areas are ageism, primary integrated care, age-friendly cities and communities or age-friendly environments, and long-term care. So her question is, what changes would the panel like to see at the end of the UN decade? And as part of your wrap-up, what is your key takeaway message to the audience today? So the question that you've been asked to answer in this session is, is local to global and aspirational realistic? And I think each of you has said it is realistic and there are caveats around that. But what is your takeaway message to the community out there and it's almost like a call to action. So I'm going to start off in the reverse order. So Mike.
I'd like everybody to be active, personally or publicly, by 2030, because all skills are needed. We have undervalued inclusion in our society.
And your takeaway message to the audience out here?
We need stronger partnerships to make it happen, and I would suggest with the financial, energy and telecoms communities, there are partnerships waiting to be established.
Thanks very much, Mike. And Grace?
I would say catching the technology with what we define, the demand-driven innovations with equity is very important. This is my take-home message. Another things that about the decade of healthy decade, I think everyone actually have the abilities, to determine, how we can contribute to the society. So the another side I would like to say, how we collect all these actions from local to global, and then we can put it up and then we can share the practice. I think this is something I would like to see.
Okay, thank you very much, Grace. And Klaus?
I think at the end of the decade, I would like to see a kind of a global open collaboration system, something you find in software with open source, which connects people and organizations to act together. It's about action now, not about talking anymore. And my takeaway today is, I think we need to think about collective intelligence and action design. A politician, Angela Merkel, said that politics is the art of the possible. Well, that is not enough today because we need a paradigm change. So I think what we need is creativity is the art of the desirable, innovation is the art of the feasible, and the community is the art of the viable. So if we connect those three, I think we can create that new future which we so dearly require.
Okay, thank you very much, Klaus. And finally, Jean.
Well, I think that big things happen in 2020 and 2021 so that the next couple of years would be really years of building. So as we think about the question from Anna Dixon in terms of exactly what changes would we like to see at the end of the UN decade for healthy aging, for me is a couple of things. One is the fact that clearly, particularly in the context of long-term care, that we've seen significant challenges with the systems. So that by the end of the decade, that we will have more resilient communities, more resilient opportunities for people to age with options across the continuum of care, that there will be opportunities for families to be able to connect with their loved ones regardless of the setting, that older adults will have more agency and more opportunity to live that longer, healthier, more productive life. And finally, I think that at the end of the decade, that we would all see that we all are really interdependent and we all have a responsibility, both public, private, and as individuals, to contribute to a society that ensures that we are all living a longer and healthier life to the extent possible.
And thank you. So as we wrap up this, what I think is a very important, dynamic and robust discussion, let's just sort of step back again and think about, I live an entitled life. That didn't come out right. I'm entitled, in my world. I have a roof, I have food, I have et cetera, et cetera. And I think, what the panel has tried to say today is that, inclusion is at the heart of current and future generations, but also the ability to be creative, to be innovative, and to be part of community. We talked about the global collaboration, Klaus, and there being a focal point. The WHO the UN and WHO in the decade of healthy aging has a digital platform. So I urge all organisations and people to actually join that, because that's an opportunity to share knowledge and experiences and make the connections. I also want to call attention to, the thinking about the Civil Society Alliance for the Decade of Healthy Aging, that will bring together multiple disciplines and multiple sectors towards a common agenda. And certainly the International Federation on Aging, is one of those organisations that really is driving that potential alliance. Because this today and across the last 2 days, we have explored and shared many important reports, ideas, good practices, but it cannot stop here. Because we have failed as professionals if it stops here. We have failed if the reports that are groundbreaking sit on a shelf.
That's right.
And it does take political will, and it does take courage, and it does take people on this conference today, you and I, and many more around the world, to stand up when policies are not acceptable, or when we can see partnerships that could create opportunities. So the call to action from this particular panel is, yes, it is possible. It is realistic, local to global, but it's going to take multi-sectoral engagement towards a common agenda and clear action plans across sectors to enable that to happen. So it has been a pleasure to be moderator of this important panel, to join with friends and colleagues, and I do hope all that have been listening to this session have enjoyed it as much as we have. So thank you very much.